But what about Shallenberger's resume? Shallenberger has, of course, several malpractice lawsuits in his past, and of course he's posted his defense to these cases, and it's definitely worth looking at both sides of the issue.
For those who don't know you, why should we listen to you? What are your credentials? What's your background?
Thanks for asking. I've been practicing medicine for almost 50 years. So I've got a lot of experience treating viruses. I know all about them. People like Dr. Fauci and all the health commissioners and such probably have never treated one patient ever. But I've treated thousands of patients over the last half a century.
Fauci is not a particularly beloved character, especially due to certain political stances he's taken. But we're looking at Shallenberger here. Shallenberger claims Fauci most likely has never treated even one. In fact, most of the health department has never treated even one patient, that therefore he has no direct experience with treating viruses. Let's compare this claim to what we know about Anthony Fauci. In the 60s, Anthony Fauci was already active in residency. In residency, a doctor already begins to treat patients, and he was studying allergies and infectious diseases. Therefore, to say that he has never treated even one patient with a virus is, to put it mildly, deceptive. But there's a lot more that we can see about Fauci's career. National Institutes of Health also claims that Fauci has been instrumental in developing treatments that enable people with HIV to live long and active lives. Now, I personally know people who have HIV, and I have watched them improve as better and better treatments became available. So if I compare this information to the claim that Fauci has never treated anyone with a virus or doesn't know how to treat viruses, I would have to consider that claim at the very least boastful. In fact, 2020 analysis of Google Scholar citations, Dr. Fauci ranked as the 32nd most cited living researcher. According to Web of Science, Dr. Fauci ranked 9th out of 2.5 million authors in the field of immunology by total citation count between 1980 and January 2021. So, no, Shallenberger would not immediately appear to be more experienced or more knowledgeable when it comes to viruses than Dr. Anthony Fauci. I have here my own copy of Harrison's Principles of Internal Medicine, 17th edition. This is from several years ago. It has a very interesting couple of pages on the SARS outbreak that match perfectly, unfortunately, what I've witnessed when some 70 of my family and closest friends all came down with COVID at the same time. They were all living in the same mission structure. And their symptoms align very closely with the SARS-CoV-2 to what people had noticed already in the SARS outbreak way back when. So regardless of course, Fauci's been criticized for all sorts of things, having been given an overly positive estimate of how few people need to be vaccinated, 60 to 70%, only to later correct it and say, actually, if we really want to see herd immunity, we probably have to get as high as 90%. Things like that have definitely undermined the confidence that people have. But I would never say that he's not a person who doesn't know how to treat viruses. And I think it is just a little bit arrogant of Frank Shallenberger to suggest that he is more knowledgeable and more experienced than a person such as Dr. Anthony Fauci, since he named him specifically in the treatment of infectious diseases. But what about Shallenberger's resume? Shallenberger has, of course, several malpractice lawsuits in his past, and of course he's posted his defense to these cases, and it's definitely worth looking at both sides of the issue. We've heard at least if you Google, you'll see the accusations against Shallenberger. And then there's a website that Shallenberger himself put up where he gives his side of the story. Let's look at just one part of his side of the story. This is concerning one of the cases addressed by the California Medical Board, where Shallenberger never responded to the accusations before the board. He accepted the loss of his medical license in California and moved to Nevada, but he later gives the public some information to help them analyze how credible the board's decision to revoke his license was or wasn't. So let's hear his side of the story, and then let's see how well his defense holds up. All the complaints stemmed from he's talking here about the complaints against him. All the complaints stemmed from the unacceptable fact that I was using natural therapies instead of medications. So this would be the only reason that he was accused. Indeed, if you look at paragraph 4 of the medical board complaint, you will see that it defines natural therapies like magnesium, vitamin B12, and folic acid as dangerous drugs. And that does strike us as quite ridiculous. Vitamin B12, folic acid are definitely not dangerous drugs, at least not in the ordinary sense. So what was the medical board thinking? Then there's a screenshot of that part of the proceedings. And if we look closely at that screenshot, though, we notice a few interesting things. The screenshot does not say that vitamin B12 or folic acid are dangerous drugs. It says that injectable forms of B12, magnesium, chloride, magnesium, and so on are dangerous drugs as defined by the California Code, section 4211. Now, an injectable form is not necessarily as harmless as magnesium, for example, taken orally. Magnesium can have an effect on your heart rate, for example. So there is more credibility to that accusation than would seem apparent at the first glance. But let's look at false accusation number 2. According to Susan Gallagher, these complaints all came from his patients and their loved ones. The facts, Shallenberger claims, none of the complaints came from my patients. One complaint from an insurance company, one from a conventional doctor, one from a resentful spouse. One came from a patient who was being treated by the doctor I sold my practice to when I moved to Nevada. So none of these would appear to be Frank Shallenberger's patients. That's what he claims. In fact, one of them was actually being treated by a doctor he had sold his practice to. That's not actually true. If we read the actual proceedings against him, they state, as we've already seen, that among the drugs he gave, the injectable forms of magnesium and folic acid and so on are deemed dangerous according to the definition given in the section 4211 of the code. And then it goes into the specific charges and allegations. Regarding patient Nancy P., full name of patient will be provided upon request for discovery. Nancy P., then 41 years of age, first saw a respondent, that would be Shallenberger, who then practiced as a physician and surgeon in or about Pleasant Hill, California on September 16, 1988. She reported a family history of asthma and that she reacted with bronchoconstriction to sulfites. Nancy P. saw a respondent again on August 15, 1990 for breathing problems. The diagnosis was asthma. The treatment prescribed by the respondent included an ozone generator, bowel detoxification, weekly vitamin B and magnesium, and a Ventolin inhaler. There is no documentation of an examination of the lungs, consideration of a chest x-ray, or spirometry. That's to measure the ability to breathe. We're talking about a patient who's been diagnosed with asthma. In a letter to the medical board, date April 12, 1991, concerning this treatment, respondent stated that he instituted treatment designed to help her liver with xenobiotic detoxification. This is a patient that has asthma. And this is a patient that Shallenberger claims wasn't actually his patient. He claims that this was a patient who was treated after he sold his practice. Let's see more about that. The next chart note is dated August 20th, 1990 and states only B6, 1 cc, mag, 2 cc. On September 12th, 1990, respondent notes that the patient was still having severe bronchoconstriction about 2 a.m. to 4 a.m. Again, no physical examination is documented. On September 12th, 1990, again, no physical examination is documented. The patient received 4 cc's of aminophylline and 4 cc's of normal saline by fast push. The billing document indicates there was an IV by a medical doctor. In addition, she received additional injections of magnesium, B6, and glycerin. Glycerin is sugar. Respondent suggested the patient may need yeast protocol. He also recommended that she might benefit from being in Mendocino and away from her job as a beauty operator. Nancy P. received intravenous therapy on September 17th, 1990 that was identical to the treatment of September 12th. Nancy P. was next seen on September 20th, 1990. The chart notes state, doing better when gets IVs. Identical IV preparations were administered. There is no documentation of any physical examination. On September 21st, 1990, Nancy P. again received aminophylline 4 cc's with sodium chloride, i.e. salt, by IV fast push. Additional IV treatments were given on September 24th, 1990, September 25th, 1990. This was not his patient. This is someone he claims this was not even his patient, but these are all treatments that he is giving. September 26th, September 27th, 1990, September 28th, 1990, October 1st, all of the same preparations. On September 28th, 1990, she was referred to an acupuncturist. On that occasion, her lungs were checked at the front desk using a stethoscope. On or about October 1st, 1990, respondent left his practice in the hands of Peter H.C. Mutke. So at this point, he leaves his practice in the hands of another physician, and from that point on, the patient is treated by this other physician, who does not seem to be much better. On October 3rd, 1990, the patient called respondent at home, fearful that she had contracted pneumonia. He prescribed erythromycin, an antibiotic, over the phone, according to the patient that she should begin hydrogen peroxide therapy intravenously. Hydrogen peroxide is a disinfectant. Why he's giving it intravenously, I don't know. Apparently, Nancy P. went to see Dr. Mutke after speaking to respondent. There is a chart note dated October 3rd, 1990, signed by Dr. Mutke, indicating he was aware of the patient's diagnosis of bronchial asthma. There is no notation of a physical examination. Nancy P. states that the evening of October 17th was particularly difficult for her, and she was unable to sleep because of difficulty breathing. She went to see Dr. Mutke on October 18th and was administered the same medications she had received on October 5th, including intravenous hydrogen peroxide. This is a patient who's having trouble breathing. Upon completion of the IV therapy, Dr. Mutke told her to do whatever you think is right in response to her complaint that she wasn't any better. At this point, she's being treated by that second doctor. She then contacted an acupuncturist who eventually, after acupuncture and tea, advised her to go to an emergency room. Nancy P. reported to San Ramon Medical Center emergency room, where she was seen by Bruce Walpin, medical doctor. His notes indicate that she had marked expiratory wheezing and an oxygen saturation of 89%. We're learning a lot about oxygen saturation, unfortunately, with the coronavirus. Anything below 95% is bad. An oxygen saturation of 89%. She was subsequently admitted to the hospital for 8 days and received intravenous steroids, standard bronchodilator therapy, including ipratropium. This was Shallenberger's approach to a person having trouble breathing. Is this a person we want to trust when it comes to the coronavirus epidemic, which particularly tends to affect the lungs? California Code explains that a dangerous drug or dangerous device is any drug or device unsafe for self-use in humans or animals. So no, the California board was not ridiculously claiming that vitamin D was harmful just so that they could get at Shallenberger. He was injecting vitamin B, injecting hydrogen peroxide, injecting magnesium, which can affect heart rates, for example. And because injections of these substances, if they're not in the right dosage, and in some cases they should never be administered, are unsafe for self-use at home, they are rightfully deemed dangerous drugs. Let's look at a more recent case of malpractice, this time from Nevada, because he didn't just have, it wasn't just California that had a bone to pick with Shallenberger. Patients in Nevada also had issues. Here's the case of patient A, who presented to respondent in late June of 2002 with complaints of rectal bleeding and pain. This was an elderly patient. If an elderly patient has rectal bleeding, one of the first things a person should think of is colon cancer. It's not a very difficult diagnosis or at all rare. Early treatment for colon cancer, as hopefully we all know, is very important. Respondent made a provisional diagnosis of bleeding secondary to hemorrhoids and recommended suppositories and witch hazel soaks for further treatment of patient A's condition. No diagnostic tests were ordered by respondent for patient A, and there is no indication in the medical records of informed consent to this treatment. That is, explaining to the patient that they're giving them an alternative treatment and asking them to consent, knowing that what they're being given is not standard medical treatment for the problem. Patient A was again seen by respondent in November of 2002. The medical records indicate that patient A was doing great. And while the records also indicate that patient A's fibrinogen levels were elevated, nowhere in the medical records does it indicate that respondent conducted a physical examination of patient A or ordered additional diagnostic testing for him. In April of 2003, the patient was diagnosed with metastatic colon cancer. After surgical intervention by a different practitioner to remove the colon cancer, respondent treated patient A by prescribing him insulin potentiation therapy with Laetrile. There is no indication in the medical records of informed consent to this treatment by patient A. Patient A expired approximately 6 months after the initial diagnosis of cancer was made. In other words, the patient didn't survive. NRS 630-3014 provides that it is grounds for initiating disciplinary action if a licensee commits an act of malpractice. NAC 630-040, for the purposes of Chapter 630 and the NRS, defines malpractice as the failure of a physician in treating a patient to use reasonable care, skill, or knowledge ordinarily used under similar circumstances. In treating patient A, the respondent failed to use the reasonable care, skill, or knowledge that would normally be used in similar circumstances in providing care and treatment of patient A. So that's Shallenberger's resume in terms of how he's treated his patients in the past. It's not fabricated evidence. This evidence is freely available and it's from official sources. We're talking about the Nevada Board and the Nevada Medical Board and the California Medical Board.